Good morning, dear students. Today we discussed about dental caries and dental plaques. What are the treatment options and what are the preventive phases for these dental caries and dental plaques? Okay, first we got is the what is dental caries. Dental caries is the common in children and young adults but can occur in all age groups. There are various ways of controlling dental caries. First is the primarily preventive measure of controlling caries include use of fluorides and dietary modification. This is the most important step. In 1940s, the prevalence of dental caries in India was 55.5%, but some recent studies shows on incidence ranging from 44 to 73%. That is now is very increasing comparing to older reports. Dental caries is the degenerative condition which is characterized by decay of hard and soft tissues of the teeth. Mainly, this infection and decaying food are the main causative factors of dental caries. So, what's the main causative factors? Infections and decaying food. For dental caries, the preventive phase is probably most important one. That is, regular brushing has been shown to be very effective at controlling caries as well as gum problems. Next we move to treatment options. First with is the ammonium ions. These ammonium ions usually reduce the incidence of dental caries. Ammonium ions are applied locally in the oral cavity. Certain dentifrices which contain ammonium or ammonium compounds, for examples like dibasic ammonium phosphate and urea carbamate. These preparations usually liberates ammonia in the mouth and are used. These are the effective dentifrices options. Urea is the used to treat dental caries and is one of the oldest chemical used. In some dentifrices, urease is present. Urease break down to ammonia by urease. Next options are a most important one is the fluoride therapy. Fluoride therapy and is the fluoridation of drinking water has played a significant role in decreasing the dental caries. This mostly preferred preparations are 2% tannins fluoride is applied locally to the teeth after cleaning. Fluoride is also increase the tooth resistance to acid decalcification. Fluoride can be used prophylactically as well as therapeutically. Prophylactically, fluoride in the form of sodium fluoride, this can be used in drinking water. 1 part of fluoride to 1 million part of drinking water is sufficient for reducing the incidence of dental caries by 50%. The local application of fluoride leads to the absorption of fluorine on the enamel surface as calcium chloride. 8% of tannins fluoride this can be applied once a week for 4 weeks. This is also helpful for preventing dental caries. Under fluoride preparation, the sodium fluoride this must be used with caution as it may cause nausea, vomiting and abdominal pain. This chronic injections usually leads to chronic fluoride poisoning, and this also affects the enamel and dentin of developing teeth. Next options are antimicrobial therapy. As the antimicrobial agents like penicillin, bacitracin, erythromycins, these are being used to reduce the bacterial count, which also leads to beneficial in reducing the incidence of dental caries. These are some other agents is also effectively in used in dental caries. This is the hexachlorophene, silver nitrate, chlorophyll. This used to clean debris and decaying material and incidence of dental caries. Next we got is the dental plaque. What is the dental plaque? Dental plaque, that is the deposition of these microorganisms and these create a biofilm. Usually this gives the yellow coloration to our teeth, that is dental plaque. Dental plaque, this can give rise to dental caries, that is the tooth decay, and periodontal problems like this gingivitis and chronic periodontitis. Dental plaque of a wide range of bacteria in a matrix of food debris, bacterial polysaccharides and salivary proteins. This dental plaques plays an important role in the initiation of caries and can cause gingival inflammations which can progress to periodontal disease. So this dental plaque or caries is the initial stage. If it's left this untreated, this leads to periodontal diseases or gingival inflammations. Drugs is used in dental plaque. Antimicrobial options, the antimicrobial agents have been studied in respect to this control of plaque, and they can be divided into different subclasses that are bisbiguanidins, quaternary ammonium compounds, phenolic agents, oxygenating agents, natural products and miscellaneous agents. First category is bisbiguanidins. Several bisbiguanidins possess anti-plaque activities. For examples like this chlorhexidine, alexidine and octinidine. This chlorhexidine gluconide is a cationic bisbiguanide, is the best known and most commonly used member of this class. So this chlorhexidine is the most important one. Commercially available chlorhexidine mouthwash, this contains 0.2% of chlorhexidine and is recommended at 10 ml volume per rinse. Main side effects of chlorhexidine: there is a chance of brown staining of teeth and tongue, formation of supragingival calculus, taste alterations and oral discriminations in children. Additionally, this results in some allergic reactions. So when you are using this chlorhexidine mouthwash or mouth rinses, we can avoid this intake of tea, coffee and red wine for the duration of its use. Antimicrobial agents like these penicillins, erythromycins, tetracycline, vancomycin, kanamycin, bacitracin, polymyxin B, these are used as topical mouth rinses or gels. Bisbiguanidine category, this the chlorhexidine is the most effective anti-plaque and anti-gingivitis agents. Chlorhexidine gluconide is 0.1 to 0.2% concentration. The solution is used twice daily. Main mechanism of action of chlorhexidine. This chlorhexidine is a bactericidal action at higher concentration, and this shows the bacteriostatic action at low concentration. This mainly binds to the bacterial cell wall and interfere with the uptake of sugars by the bacteria. Main uses: this chlorhexidine is used as mouth rinses, gels, dentifrices for control of plaque and gingivitis. Mouthwash is also used to disinfect oral cavity before dental procedures, and is also useful in case of ulcerative gingivitis, and is also useful in case of following oral surgery and denture insertion. This mainly prophylactically used in leukemia and AIDS granulocytosis. Next come to this fluoride therapy. Fluoride therapy is also important for this controlling dental plaque. Fluorides usually inhibits enzymatic reactions involved in glycolysis. These fluoride preparations like Stannon's fluoride mouth rinses or gels are effective in plaque control. Some of these oxygenating agents also have a great role. This acts by liberating nascent oxygen, for examples like hydrogen peroxide and sodium perborate. And these halogens categories like chlorophos, iodophos, these are used in many antiseptic mouth washes. And this chlorino dioxide, povidone iodine, this also shows the better effect. Next categories are phenol and its derivatives like this hexyl isoquinol, thymol. This is also helpful in controlling anti-plaque. These are also used in anti-plaque mouth rinses. Main disadvantages of these preparations are disagreeable taste, rapid discoloration, and poor solubility. Next is the combination of certain oil shows the beneficiary actions like this thymol, eucalyptus oil, menthol, methyl salicylates in an alcohol base is also effective for controlling dental plaque. Detergents like sodium lauryl sulfate mouth rinses is also another options for this treatment. Next category is non-ionic bisphenols. Triclosan is a germicidal agent mainly used in toothpaste. It has a wide antibacterial spectrum. Mainly this shows the gram-positive and gram-negative bacteria. This is usually used in combination with copolymer in toothpaste. Useful in controlling plaque and calculus formation. Thank you so much for your patient listening. Okay.